Suicide is the 10th leading cause of death in the United States and is recognized by the DuPage County Health Department as a large and growing public health issue that affects people of all ages. Joining me to discuss suicide prevention and the programs offered by the Health Department is the Assistant Director of Emergency Services, Kathy Carey. Kathy, thank you for joining us today.
Thank you for this opportunity to talk about something that's so close to my heart.
You're absolutely welcome. Why is it important to discuss suicide and suicide prevention efforts?
It's really important that we talk about suicide so that we really can start to understand the issues that surround suicide, and that allows us that opportunity to really increase our prevention efforts. Through talking about suicide very openly and directly, that's how we have the opportunity to save lives.
Are there signs to look for that someone might be having suicidal thoughts?
Yes, there are some warning signs that we can look out for. Some of those might be somebody talking about wanting to die or wanting to kill themselves. It might be talking about feeling worthless, hopeless, that they're a burden to others, and just generally not having a reason to live. We could also see some behavioral changes, like folks might start drinking more alcohol, using substances more, having extreme mood swings, or being very agitated. Those might be some warning signs to look out for. Those signs would be much more concerning if somebody also had what we call risk factors. Some of those risk factors might be having a mental health condition, a substance use disorder, or experiencing some level of significant loss or change.
And what type of losses would you look for?
So it could be really anything. It could be losses of relationship, possibly through divorce, breakup, death. It could be a financial loss or change through job loss or other significant financial changes.
What services and supports does the DuPage County Health Department offer?
Here at the Health Department, we do have crisis services within our Behavioral Health Services Division, and we're able to provide services 24 hours a day, 7 days a week, every day of the year. We have one crisis line that the Health Department operates. We have clinicians trained answering those phone lines, being able to provide support, assessment, and linkage to anyone who calls.
Sadly, every year, many people lose their lives along railroad tracks because they're either trespassing or attempt suicide by train. The trains that travel to, from, and through DuPage County every day are part of an incredible railway network that has moved people and products for more than 150 years. From the DuPage County Board of Health, Dr. Lanny Wilson. Dr. Wilson, thank you for your time.
It's my pleasure.
You're a longtime resident of DuPage County, Dr. Wilson, and chair of the DuPage Railroad Safety Council. There's a program that's being used to lower the number of railway suicides. Tell us about Question, Persuade, and Refer.
Today, METRA is questioning, persuading, and referring over 100 people per year.
Wow.
And getting them help. That will help save people, especially those who are attempting suicide.
So they're actually now having this program in use. Are there any numbers to show how it's working?
Yes, in fact, this past year, METRA has already accomplished our goal of a 50% reduction in their suicides, and primarily by using this QPR system.
Wow, that's incredible.
We set this goal for 10 years nationwide.
And they hit it in a year.
METRA's already succeeded in 1 year. With the suicides, now with trespassers, we're still working on that a little bit, but there's great hope there that we can use in DuPage County, in Chicagoland, and throughout the nation. Yes,
wow,
sir.
That's fantastic. And one of the things that you've done is lobbied to have these railroad crossings changed to make additions to the gates themselves, correct?
Oh, I love the 4-quadrant gate systems that are propagating throughout our country. You know, when we started this back in 1994, there were only 2 4-quadrant gates in all of North America. One up in Rhode Island, another in Canada. Today, in Illinois alone, there are over 200 4-quadrant gate systems working, and they're working tremendously well. From the latest statistics, there has not been one death at the crossings where these 4-quadrant gates are in place. But in about the year 2000, the number of deaths by trespasser and suicides increased beyond the number of deaths at railroad crossings. There's a remarkable increase in the numbers of suicides and trespassers as opposed to deaths at railroad crossings in vehicles. When we realized this about 2 years ago, we decided to focus on the trespasser suicide issues in order to see if we couldn't see the same decrease in the death numbers with trespasser suicides that we were seeing at crossings. We really are dedicated to trying to make that number 0 as far as suicides by train in DuPage County, in Chicagoland, and nationwide.
And around the world.
Yes, sir, and around the world.
There is suicide prevention information on our website, DuPageHealth.org, and the crisis services number is 630-627-1700. For the DuPage County Health Department, I'm Public Information Officer Don Bolger. Thanks for watching.